Friends, you've come in mid-conversation with Dr. Rob Davidson. He is the executive director of the Committee to Protect Healthcare, not destroy healthcare, the Committee to Protect Healthcare. Also, he's an ER doctor like me. He married up. Also, he married a doctor, and he is also the host of the podcast Paging America. And the reason why we have him on, I think this is very important. Yes, multiple crises in the world. There's the
Mm.
Epstein files. We might have war with Venezuela to distract from the Epstein files. The economy is in shambles. Meat prices. ICE agents terrorizing innocent Americans. But what we just saw also is that 8 Democrats, specifically centrist Democrats, decided to go against the party, go against the majority of the people, and decide to cave and end the 40-day shutdown without getting their guaranteed promise of extended Obamacare subsidies. Now, for many people, uh, what I just said, they're like, well, so what? How does this affect me? And I know we have a very informed audience that probably gets this, but a lot of people don't. You caught me in mid-conversation with Dr. Rob. I was saying, I asked my wife, who's a doctor, healthcare insurance just boggles my mind. Explain it to me. And my wife, a doctor, says, yeah, it's confusing to me too. It doesn't have to be this way, but this is how it is in America. So, of
Yeah.
course, Rob, it doesn't have to be this way. But now, if you can, let's just do step by step. If you could just explain it to people, right? Let me ask you questions like an 8-year-old and just indulge me.
Yeah.
Uh, I've heard a lot about Obamacare subsidies. What are
Yeah.
we talking about? What is this?
So basically, Obamacare subsidies, it's money you get, basically a tax credit to help you pay for health insurance premium. So you go on the Affordable Care Act marketplace in your state, or the federal marketplace if your state doesn't have its own, and you can buy insurance for a certain amount. And based on your income, I think your income the previous year, you will qualify for certain subsidies. So you only pay so much, whatever that number is. It kind of can slide a bit, but you only pay so much for those health insurance premiums, and the rest of it is made up by a tax credit from the government. And that's basically it. It makes it affordable for millions of people. And you said people maybe don't know, but I will tell you, my wife, who is a doctor, she's a family doctor, so she has conversations. She said yesterday in clinic alone, she had 3 people come in and trying to get certain tests done, procedures done before the end of the year, because they are anticipating they will not be signing up for insurance next year because
That
of what's coming.
and,
Like,
and now
yeah,
people are forced to know
yeah,
because it's been in the news for a bit, and sadly, it's in the news now because people are like, "Whoa, whoa, whoa! What do you mean my
yeah.
healthcare costs will go up?" So my wife's also a family doctor. I want to ask you this now. What you just said, that sounds great. All right, we're the wealthiest, most powerful country on earth. We have Obamacare. The government gives these subsidies that allows us to actually make healthcare somewhat affordable, even though in
Yeah.
America it's totally costly and inefficient. But I digress. Nonetheless, at least it'll be better off than without the subsidies. So why would anyone want to get rid of these subsidies?
I mean, I think you'd probably have to have a Republican member of Congress on here to try to explain that to you. I just actually we recorded our podcast today with a guest host, a fellow ER doc from Wisconsin, Dr. Chris Ford, and we were just sort of scratching our heads, like, do these folks not understand? Do they understand and not give a shit, or is it a little bit of both, or all of the above? I think there's a little bit of all of the above. I mean, if you looked at those 8 Dems that caved or whatever they did, right? They went with this deal that isn't much of a deal, and a lot of that was the pain that was being inflicted by Trump and by Republicans on regular people, and they have expressed they were hearing from their constituents, like, we can't feed our kids, from federal workers who have been laid off, haven't been paid. And so, and Trump like went to court, they went to court to sue and took it to the Supreme Court to not have to feed hungry kids, right? To withhold SNAP benefits that they were legally required to pay. Like,
And had
there
the money to
is,
pay for it. They had the money.
yeah. So there's no limit to the amount of cruelty. Certainly Trump and by extension, Mike Johnson, the entire Republican caucus, because they were complicit in all of this, and they, held firm, didn't want to cave. They didn't want to give in and make healthcare more affordable so that then food could be attainable by hungry kids. And so they apparently are willing to withstand the political pain they may endure, which they will. Like partly groups like mine, organizations like mine will make sure they do. But also they're willing to allow their constituents to endure pain, apparently, and it doesn't have limits. I think that's the bottom line.
And I appreciate that answer because you try to really logically think like a somewhat decent, empathetic, non-psychotic human, right? Like
Yeah,
you're like, wait. So we just had a 40-day government shutdown. Republicans own the House, they have the Supreme Court, they have the White House, they have the Senate, and Republicans, even though they have the money, the government has the money, they refuse to fund SNAP, which then gives food to 43 million food insecure people. Okay. And then what's the main contention? Yeah, because most people don't know. They're just trying to live their lives. So wait, okay, so Democrats are fighting for extending Obamacare subsidies. Oh, so that makes healthcare affordable to people. And
yeah.
and we have the money, but they're choosing not to. Okay, why? Oh, just because they don't want to. And then now it goes to what happened a couple of days ago. Donald Trump is on the ropes. The poll numbers are terrible. Like you said, now you have even your wife's patients are coming in. Now it's in the news. Oh shoot, I might lose healthcare, right? Healthcare has gone back to a top three issue again with rising healthcare costs. Economy is in the shitter. He's negative 30. He's negative
Mm.
double digits on immigration. He's at approval rating 36, 37. Just today, Dr. Rob, it came out that he's negative 39 on Epstein. Okay. So you would think their back is on the ropes. And yeah, maybe Trump doesn't care, but these House Republicans, they're going to be running in some tough races. You could probably get them to cave. When you found out that those 8 Democrats caved, your response?
I mean, it was a bit of a shock, right? Particularly in the after the last Tuesday's elections, right? Particularly after the complete blowout, the fact that Democrats overperformed at these two statewide races in Georgia for Public Service Commission. I don't know exactly what that is, but it sounds great to me, and it's the first time Democrats have won those, right? So the fact that they just got completely shellacked, the Republicans did, and they were on the ropes. I guess the only thing I can imagine, and I did actually interview a Hill reporter from CNN today, and they kind of expressed Republicans were making it very clear we will not budge. We do not care how much pain this is causing people. We will not budge. And I think to try to negotiate, if you have someone who takes a hostage and they're willing to start shooting hostages, how do you negotiate? How do you negotiate? How do you bring them to the table? I don't know. I don't know how that works. I think those Democrats didn't know how that works. I think Chuck Schumer sort of allowed this to happen, even though he voted no. I mean, he's the leader. And the other thing is that these negotiations, so to speak, had been going on for a lot longer. It wasn't just a sudden capitulation by the 8 Dems. This has been something that they've been talking about for weeks, and Schumer kind of held it off the previous Friday when he went to them with that plan to extend the ACA subsidies by a year, and Republicans just said, no, no, we're not doing it. I really think they just recognized these guys aren't budging. And I guess the alternative would be to keep the government shut until January of 2027, when a Democratic House would be seated and they would have Speaker Jeffries or whoever else that would be. I don't know what the alternative would be. I don't know if you have thoughts on that or if you've heard
I
other
do.
alternative theories.
My real quick, my alternative theory on this, and something I immediately thought about, maybe because I'm a cynic and I always try to follow the money, is Sean Duffy came out and slash threatened and said that airline traffic is going to trickle.
Mm.
It's going to be really bad. Do you think it's bad right now with these record number of delays? We'll just wait. And then what's happening in 2 weeks? The busiest travel season, the biggest travel days of the country. Also, if the religion of America is capitalism, then our religious holidays are Black Friday and Christmas. And I know the airline lobbies give a lot of money. And the airline lobbies, if you have canceled flights and everything's going to a trickle, that means they're on their busiest, most lucrative day or month, November to December, they're going to lose a lot of money. And then we found out that, oh, yeah, the airline pack actually gives money to all those 8. But that's just me
Mm.
being cynical. Who knows?
Yeah.
Either way, the point stands is that they essentially reopened the government, got an inshallah promise that the next day
Mm.
Mike Johnson said, nah, I'm not going to hold a vote on extending the Obamacare subsidies. So now the thing that you held out for so long, you're not going to get, and people are going to get more screwed. Now, this is where, can you explain to people what's going to happen to their health care if these subsidies are not extended?
Yeah, so basically we already see, irrespective of the subsidies, premiums going up by 10%, 20%, 30% more, right? People are getting those notices. They've gotten those notices as of November 1st, and now they're enrolling. If these don't go through, in addition to those increases in the premiums, people who get their health insurance on the marketplace are going to lose the subsidies. So they're going to see doubling, tripling, even more of the premiums because they are going to have to pay the full sticker price. They're not going to get a discount based on their income. For some people, they will do that. Some people will go and choose a lesser plan with the $10,000, $12,000 deductibles. Essentially, for most things, becomes non-insurance, right? $12,000 deductible for somebody making $50,000, $60,000 a year equals not having insurance, essentially. I guess if you are diagnosed with cancer in January, or you fall off a ladder and break your back, or have major surgery, okay, sure, you're not going to have to mortgage your house. You still may have to mortgage your house because more than half the country can't afford a $500 emergency. If their muffler falls off their car, they can't afford it. I have patients all the time. I try to transfer them an hour away to the bigger tertiary hospital, and they can't afford gas in the car for their family to come and see them and come pick them up. We have to pool together money in the ER or get a gas card, that the hospital can write off. And so yeah, that's the reality. Some people will choose lesser insurance. Some people will pony up, not that many, but a lot of people will just say, okay, I can't afford it. They'll be among the uninsured. And then when they get sick,
Leslie said her went up from 264 to 2150 a month.
Jesus, yeah.
And
Like, it's not sustainable. Nobody can do that. Nobody can do that.
you can't. If your health insurance is a third of your annual salary, especially in an economy which is either in a recession or heading to a recession,
Yeah.
where wages are stagnant and prices of everything are up, and electricity has gone up because this dumbass has now aggressively attacked clean energy. And furthermore, our allies are turning away from us, and these stupid trade wars with these tariffs are now going to increase prices more and more because there's only so much that people can eat. Restaurants and others, they have to pass it on to the consumer. That's us. Um, and now you have this. The end game seems to me to be like a type of sociopathic cruelty to keep
Yeah.
us poor, broke, sick, and dead.
Right. But now, right? Trump was spitballing over the weekend on True Social or whatever he uses, and threw out an idea. Well, instead of the subsidies, now what you'll see now is a whole parade of Republicans who suddenly don't want to give money to for-profit insurance companies, right? They've propped up this for-profit market for forever, right? They all take money from them. Um, They've worked to privatize Medicare through Medicare Advantage. They pushed that. Medicaid, 70% of people on Medicaid are on privatized Medicaid. It's run by large health insurance companies like United Healthcare, like Aetna. And so Republicans suddenly are worried about, all these insurance companies making profits. And so now they're floating an idea. Well, we're just going to give that money to people. Let them go buy their healthcare with that money. Again, the problem is you can't buy healthcare as an individual. You're taking the shared risk of large populations, because that's how the only way insurance works. Going back a few steps, Republicans screwed over the Affordable Care Act a few different ways already, right? By repealing the individual mandate, they took a whole bunch of healthy people out of that pool. They raised the risk overall, raised premiums on everyone else. They then, in 10 states, have not expanded Medicaid. In those states, premiums on the marketplace are at least 10% more on average,
And
because
that's
you
the
have,
choice by the
yeah,
local Republican leadership.
yeah, Republican legislatures, governors. I know in Wisconsin they have a Democratic governor, but their Republican House refuses to expand Badger Care in Wisconsin. And it's, I think, the last of the kind of blue wall states that hasn't yet done that. Here in Michigan, 1 million people are on expanded Medicaid, right? 1 million people who have affordable health care because of the Affordable Care Act, simply because Medicaid is now available to them. Those are people like, the working poor, right? Working a few different jobs. They probably make enough to make ends meet, but only just. And, affording even a premium of a couple $100 a month would just be something that would not fit in the budget. By not expanding in these places, they push more people into the marketplace, right? Into the Affordable Care Act. These are poorer folks who maybe have less access to a doctor because they're working two jobs, working 60 hours a week. They let things go a little longer. Maybe they don't have this disposable income for a few prescriptions here and there, or certain procedures they may need. And they end up coming into me in the ER when they're having a heart attack or a stroke. Now their care is more expensive. Now they lose their jobs, they go on disability, end up on Medicare, and then the government's paying for the insurance anyway. It's such a ridiculous cycle. And Republicans have done everything they could to completely break this. And this new scheme of theirs, just to give money to the people, it's like the death spiral for the Affordable Care Act. And for Trump, it feels like he just hates Obama so much because Obama was a decent person. His presidency had pluses, had minuses, right? Certainly, as a human being, like Donald Trump cannot even, carry any his luggage compared to President Obama, and Trump hates him. And because they called it Obamacare, I think he can't handle that. And Republicans are so afraid of Trump and what he could do to them in primaries. It seems politically they're going to go along with it, right? They'll go
And
with the
so
flow of it.
I've been waiting, what, nearly 15 years for the Republican response to Obamacare, right?
Yeah,
15 years, I think it's been.
the
Uh,
plan.
Yeah, the plan, right? I'm still waiting. I think Dr. Oz was
Mm.
asked about it 2 days ago. He says, no, don't worry. Inshallah, it's coming. So it's been about
Mm.
15 years. My math is correct.
Jeez.
Because I've been told they want to repeal and replace Obamacare. And then I've always asked, well, what do you want to replace it with? Still no answer. So it seems like they want to completely dismantle Obamacare. Now, if
Yeah.
they're successful, Rob, in dismantling Obamacare, just break it down for us. What happens if they completely neuter it?
Yeah, I mean, you go back to what we had before. You got another 20, 30 million people who can't afford insurance, right? You have more people getting charity care at hospitals. If you completely repeal it, you lose expanded Medicaid. That's, even more people here in Michigan, a million folks. And so then you have people who don't go see doctors because they can't afford it. They can't get doctors. They can't afford prescription drugs. They get sicker and sicker. They wait. They come to the ER because they have no choice, and now they can't pay their bills, right? That becomes part of the charity care that hospitals then have to get emergency Medicaid coverage to pay for that, and then therefore costing hospitals, costing communities, costing the federal government even more money. It's nonsensical, right? It doesn't make sense economically, but just in a sense of humanity, it makes no sense. It's cruel. So that's back to the Great Wild West, where just all those people have nowhere else to go.
Yeah, and it's a survival of the fittest, the type of eugenics policy embraced by Elon Musk and RFK. I'm using the word eugenics very deliberately, folks.
Yeah,
Just
yeah.
listen to them. Survival of the fittest, herd mentality, right? No vaccines. The people who survive. The thinning of the herd. Non-useless people apparently will be culled. That's what Curtis Yarvin believes, who's the philosopher of J.D. Vance and Peter Thiel. I'm not making this up, folks. And speaking about RFK. He is the director of our Health and Human Services. Another story that I've tried to, there's so much happening, Rob, but I try on the left hook to, once a month to talk about the systematic attack on our healthcare system, the dismantling of our public healthcare infrastructure system by Donald Trump and MAGA. I don't think enough people are paying attention to it, but maybe what's happening with the CAVE and the Obamacare subsidies, people will pay attention to what's already happening. Can you talk to us about the dismantling of HHS?
Yeah, I mean, HHS oversees, the CDC, the NIH, the FDA. They oversee CMS, which runs Medicare and Medicaid. And RFK Jr. Literally has taken all of the experts, all of the people who actually know what the hell they're doing in these agencies, and replace them with his lackeys, people who answer to him, right? Replace them with people like Dr. Oz, for instance, right? At once, I hear was a reputable cardiothoracic surgeon turned TV doctor turned pusher of remedies that profited him but didn't help his patients, and Dr. Crudite, who lost the Senate seat, but then endeared himself to the Maha movement, to the MAGA movement, and got himself a prime seat overseeing a system he doesn't understand. So that's one piece, right? They've gotten rid of all of the career people at CDC who just adhered to evidence-based medicine, evidence-based public health practice, and replaced them with people who adhere to RFK Jr.'s warped sense of reality about vaccines, apparently about circumcisions, maybe about Tylenol. We don't know. Depends on what room he's in. If Trump is there, he's still against Tylenol. I mean, it's crazy. I talked to Dimitri Daskalakis. He left the CDC famously when the CDC director was fired, and he just said it's like it's a zombie CDC right now. Like, it's there in name, but it's not providing real guidance to all of us. They've gutted funding for research. I think notably for cancer in kids, brain cancer,
Yep.
brain tumors in kids. They've sidelined any funding for mRNA vaccine research. The only reason that Donald Trump accomplished anything in his first term, right, getting us a COVID vaccine. The singular achievement of his entire first term of presidency was getting us a COVID vaccine because of the mRNA vaccine platform technology. It's a treatment that treats cancer. mRNA vaccines also against brain tumors, deadly brain tumors that showed promise. They decided, oh, we're not going to do that because RFK or someone else got some kooky idea about mRNA vaccines. It's really sad, right? So we see the Western Health Alliance popping up, right? Groups of states on the West Coast, groups of states on the East Coast. We have to depend on public health in our counties, in our communities. And if you live in a state like Florida, where Joseph Ladapo is running your public health department, like he's a little mini RFK, you're shit out of luck. You're
Well,
gonna
I'm,
get
I'm
sick.
glad you mentioned Florida because people are forgetting that in Florida, with Lapato there, a mini RFK who's aggressively anti-science and pro-death. Now the
Mm.
MMR vaccine that you and I took, as kids, now that's gone. So now they're like, oh,
Mm.
vaccine hesitancy is up. We've spread a lot of bullshit on right-wing media for the past 5 years about vaccines, which means, folks, that parents are not vaccinating their kids against measles. And
Yeah.
so now measles is skyrocketing. And then also, if I remember correctly, RFK's handpicked CDC director, whose name I'm forgetting, who then refused to quit, but then he replaced her, and she was at the hearing. Do you remember her name? What's her name?
Dr. Monteza, I believe.
Oh, yeah, yeah, there you go.
Yeah.
He said,
Yeah.
I worry not only about measles, I worry about the recurrence of polio in America.
Yeah. Yeah. I mean, I see things that people don't make the headlines like measles and that, but there's a disease called epiglottitis and meningitis caused by Haemophilus influenza B. It's a bacterium, and we've pretty much eradicated it. I remember the days early when I was in med school and residency back in the 90s. These things were real. Epiglottitis is you get swelling, little kids get it up their throat, they come in, they can't breathe, like will kill kids, and it doesn't happen anymore. Like I have not seen it since I was a medical student. It's crazy. 25, 27 years now of practice, and I just don't see it. Nobody sees it. So we have to relearn these things. I had a case of 3 cases of whooping cough come in last month because we had a little outbreak in a school. Bunch of unvaccinated kids kind of brought it in, and that's the problem, right? Vaccines are not perfect, right? On a population basis, they are incredible. We had a speaker when I graduated medical school. They talked about those of us going into the trenches, right? Touching patients and doing direct patient care. You're going to save some lives. You're going to do that. But the people who are going to save the most lives, those are the people doing basic research. Those are the people doing vaccine research. That's who's going to save millions of lives on a population basis. But when you vaccinate a whole, the vast majority of a population, it doesn't provide perfect protection. Not every person responds to a vaccine perfectly. But if enough people are vaccinated, that infectious organism just isn't there. And so now you're putting people at risk who were vaccinated, maybe the 2, 3, 4% who didn't respond as well, who might be a little bit at risk, or the people with cancer and chemo, or people with immunocompromised status for other reasons. You're putting those people at risk, the people who chose to be vaccinated and protect themselves, their families. It's to me a dereliction of duty of anyone who calls themselves a public health practitioner or a physician. And we're going to feel the effects for at least a generation.
I've been saying this for a while, and people always said, "Oh, why'd you suffer from TDF?" I call it a pro-death movement, and I
Yeah.
use the pro-death movement, and I used facts to why it's a pro-death movement. And people said, "No, no, no, whatever." And what more do you have to see? Anti-vax, vaccine hesitancy, return of measles, return of polio, the gutting of the CDC. We're flying blind now because we don't link up with the World Health Organization. Gutting of the National Institute of Health. I think cancer research was cut by 30%. the attempt to gut or dismantle the entire public health infrastructure system, replacement of men and women who spent their entire lives at the cutting edge of research with quacks and freaks and eugenicists. And just real quick, a personal note before I ask you about and I pivot. People say, well, how does this really, how does it affect me? My daughter is a cancer survivor. She turned 9.
Oh, wow.
Right before she turned 3, she had a hepatoblastoma, a very
Oh,
rare
wow.
form of
Yeah.
child cancer, as you know, stage 4 liver cancer all over her liver, and it moved metastasized to the lung. And thankfully, she's alive. She got a anonymous liver donor later, who we found out was Sean Zahir, and she survived. But they took a piece of her liver, and Rob. And the reason why they took a piece of her liver, they said, because this is still so rare, we want to research on this liver,
Yeah.
right? And
Yeah.
then my wife was saying, God forbid this had happened 10 years previous, Nuseba, our daughter, might have not survived because we do not know enough. So, like, the
Yeah.
fact that we know, and the fact that this happened now as a result of the research and the investment and the experience, now enough people know. And even now, they still want to know more. Like, how could cancer happen in a 2-year old's liver? So they literally have a piece of liver. Like, can you donate a piece of that cancerous liver? And we're like, of course.
Yeah.
So just now that that's cut off, folks, just imagine. So my daughter is a beneficiary of not just insurance through my wife, not just excellent healthcare because we're in the DMV right here. So we went to Children's Hospital in Georgetown, not
Mm.
just trained experts, but also researchers.
Yeah.
And then also on top of that, I will say, Rob, even with all that, I still had to do a GoFundMe and raise $200,000 because we had to take about a year and a half off. And I did the math, and actually not 200,000, about 120,000. And that's what kept me from going bankrupt personally, or else I would have to declare bankruptcy. Uh, and so I'm just letting sit with that for a second, folks. Now imagine everyone else. Now imagine everyone else right now. And cancer is what, the number 3 killer or number 2
Yeah.
killer?
I don't know. Top three for sure.
It's like top 3, right? I think heart disease is number 1. I think cancer might be second. If anyone has the answer on that, let me know. I definitely it's top 3.
And
So
kids,
this is
gun
what
violence.
yeah, gun violence. Thank you.
Yeah.
Number 1 killer
And
of
kids.
children for the past in this freaking country. Number 1 killer of kids and young teens is gun violence for the past 2 years.
Ugh.
So we have all of that. I haven't even asked you
Hmm.
about the big beautiful bill, the big billionaires bills, and the gutting of Medicaid to the tune of $1 trillion, and people still aren't talking about it. I don't know why, because it's coming up in a year, in less than a
Yeah.
year. Rob, talk to us
Yeah.
about the tsunami that we're about to get hit with.
Well, I'm talking about it like we're talking about it. Okay. So I will tell you there are a lot of health advocates. This is all we talk about when we're meeting and conspiring and figuring out the plan for the next, 12 months. Because we have to talk about it because they cynically set these cuts to happen after the midterms, right? So people may not see the direct impacts in their everyday lives. Right. So what they did, they literally cut $1 trillion from Medicaid to give tax cuts to billionaires. I mean, it really is that easy to understand. What it does is it puts hospitals like mine, particularly rural hospitals, urban hospitals, but everywhere. It puts every community at risk. When hospitals close because they have a high proportion of patients getting Medicaid. You cut $1 trillion and then you put $50 billion back as the rural hospital fund, they call it. It's like a little Hunger Games lottery that states have to apply for. And who knows the process by which they get selected? We'll see. I think there's just somebody at the White House or somebody at HHS who's just kind of rolling the dice or spinning the wheel
Did
and
you vote
deciding
for
who gets
me?
what.
Did you
Yeah.
like me? Did you
Right.
vote for
Yeah.
me?
Right. Are you a
Okay.
red state? Are you a blue state? Did you kind of bend the knee? And so, they took $1 trillion away from the whole system. They cynically put 50 billion back and want to run around and campaign on that 50 billion as if it's an isolated pot of money that they're doing to save rural hospitals. I'm worried ours could close, right? It's not on the list of the most high risk of closing, but certainly losing services, right? So a hospital isn't just a place people go when they're sick to be hospitalized. It's a place that has outpatient x-ray, outpatient lab, that has mammograms, right? You can get your colonoscopy in a rural community. That's where you go get your colonoscopies that you get every 5 years. Um, And when those things go away, people then have to travel. Like I said before, people sometimes don't have the gas money to do that. I remember I had a mom who came in at 3 a.m. with their kid with an ear infection one year, and the nurse was being a little cynical. Oh, why are they here for an ear infection? And I asked, she said, well, we have one truck between three houses. This was the only time it was available. I'm like, wow, that is not a life I live. And I have to ask the question to understand, how folks have to make their decisions. When those realities exist, particularly in rural areas, and they say, well, you got to drive an hour, 2 hours to the big place if you're having chest pain, right? Or even if you just simply need your screening test, and they say, well, I can't really do that. And then 5 years later, you get diagnosed with colon cancer or with breast cancer that could have been picked up. That's the reality. That's what they did. They're they're
And
they're killing people.
the closing of hospitals, the closing of
Yeah,
nursing homes, and I don't think people realize Medicaid also helps childbirth. Or right when it comes to
40%. I think in our county it's 50%, but overall 40% of childbirths are paid for by Medicaid. People
whew.
with Medicaid. Yeah.
So if you're
Yeah,
pro-life,
I mean, it's not pro-life, right? It is
yeah,
it is extremely pro-death. And the reality is that people just want to be selfish and say, well, I'm not on Medicaid. What do I care? If that hospital closes, guess what? It closes for everybody. They don't just keep open the private insurance wing or the millionaire billionaire wing. Now, millionaires and billionaires, they can fly in the jet, they can go wherever, right? They can go wherever they want. They don't care. It doesn't matter. And members of Congress have insurance, so what do they care? They don't care. Yeah.
I'm so glad you mentioned that. Let's just tease that out a little bit because you learn a lot about human nature, and you look
Hmm.
at the Trump's second election win where he barely won, and people who I expect a little bit more from, I was talking to them, and even though they didn't vote for Trump, I heard this a lot, Rob. We survived 4 years. The country needs a shakeup. People will learn. People need to suffer to learn. And then I heard for some really just selfish people who gloated and voted Republican, even though they were brown or black or LGBTQ or a woman. I call them chickens for Colonel Sanders. Uh, they're like, won't bother me. I'll be okay.
Wow.
One person I remember said, "Well, what's the word? What Jad?" He was really sincere. I've shared the story before. It was right after the election. I heard you. And I had to go give a fundraiser, and it was a moment of levity. We raised some funds for schools, but at the same time, I had this moment where I saw where the country was going, and I said, it's going to be tough. It's going to be a tough road, and we all have to stick together. And I got a little somber. And afterwards, he goes, "Well, Dad, but really, I'm a Republican. This is a brown guy, all right? I'm a Republican. Well, I just came from a party, and we were just having a great time and owning the libs, ha ha ha. But you seem really worried. Why, man? This happens back and forth. Republicans win, Democrats win." And I gave him some examples of what was about to happen. So 10 months ago, Rob. And he said, "So I'll have to pay my gardener $10 more. So what?" Uh, and that sentiment of "so what? It won't bother me. Meh, America needs a shape up." Can you just expand to those who think they can escape this, especially when it
Yeah.
comes to healthcare? Let's
Yeah, I
talk
mean,
about the wealthy person who thinks, "I live in a gated community. My kid goes to a private school. I golf with Chet. I have two Teslas. Meh, I'll be fine."
the sad reality is that person might be fine, right? Because they could just go pay cash. They could pay with a credit card. They could write a check. They can pay for their health care. But as we have a brain drain from this country because we're not investing in research, because we're kind of taking medical schools and universities, and if they don't adhere to the dogma of the administration and their particular views, they're going to shut them down or threaten their funding. And now people aren't going into this practice of medicine, right? If you have states where women have no reproductive rights, and you have hospitals closing left and right, so you can't bring doctors into those places, and people aren't training there. We've seen training programs in states where they have abortion bans, have massive reductions for OBGYN, for family practice, pediatrics, and all of the specialties. And
Texas
now
and
that is
Florida.
a reality. That's so your reality. So you're a rich guy living in Florida. You got your Teslas. You got your gardener. You're going to pay a little extra. Well, if there's a big brain drain, which there already is signs of that, and we see now 10 years down the road when those people aren't there, you don't have people filling those jobs. You don't have the specialists. You don't have the primary care doctors. It doesn't matter how much money you have. I guess you can hop in your jet and fly to a state that didn't do that. You can fly to New York and get your procedure. Fly to California and get your procedure. But that's then the reality, right? But it ruins entire communities. It's like when the manufacturing plant closes in a small town, the community dies. When a hospital closes, in addition to being the healthcare center of that community, it's often the biggest employer of the community. And when it goes away, all those people who had jobs there, they don't just stick around working at McDonald's or working at a Taco Bell, waiting for the hospital to open up when the next administration comes and restores funding. They leave. They leave the place. They got to get jobs somewhere else. So what? So we fix everything in a few years, right? 4 years, we get a new administration. We get at least a party that, while not perfect, does believe, okay, we should have hospitals that function, right? We should have people with semi-affordable insurance. It doesn't matter, right? Those places are gone. It's generational. It's going to take generations, and it just has those ripple effects. When the doctors aren't there, when the buildings aren't there, where they need the care. Particularly then, when all those people in rural areas have to go to the big hospital, you have longer waits in the ER. You have longer waits to get your then procedure done because there's just more people needing the care in that place. It will affect the guy with the Tesla eventually. It will.
What happens if you're that rich guy and you just happen to be on a business trip and you have a heart attack in a community and you have to rush to the hospital and it's gone?
Yeah.
Or what
Yeah.
happens if your wife is with you and you're rich and you're wealthy and you know what? She wasn't supposed to go to labor, but she just happened to go to labor 10 days early and you happen to be stuck in a place where you can't get to a private jet and you need to go to that rural hospital to deliver your kid. That hospital is shut down. Or what happens, I don't know, if there's a once in a lifetime pandemic and there's no vaccine and we all depend on each other. Oh yeah, I forgot COVID.
Yeah.
Maybe, it's
I mean,
very
the great
painful.
equalizer also will be the infectious diseases that come back, right? Polio, measles, they don't care. They do not care your checkbook. They do not care what kind of car you drive. If you're susceptible and you're available, they'll find you and they'll infect
And,
you and your kids.
and if you're wealthy and if you're immunosuppressed and you're old, like Rob said, they don't care. They don't discriminate. These infectious diseases don't discriminate on class or gender or race. They're gonna eat everyone. Final question I have for you, Rob, and I hope you can come back. It seems that people really enjoy your expertise, and I really appreciate a member from your community reaching out and trying to connect with us. We were supposed to talk last week. Um, I refuse to die quietly, or I refuse to die in
Yeah.
a way without at least doing something. What should blue states and specifically blue governors do to create a wall, to quarantine the rest of us from death?
Yeah. I mean, I think you have to find creative ways to support particularly people who need insurance. In Michigan, our governor and our state senate, run by Democrats, somehow got the Republican House to sign on to a budget that actually restores Medicaid funding. They found a way to do it, to have the Medicaid funding, so we won't see the dramatic effects that they did from the big beautiful bill or the big bullshit bill or whatever you want to call it. So I think that's part of it, right? You have to work to restore and to maintain those programs. I think you have to have a very strong communication presence for public health, because what's coming out of DC, what's coming out of RFK Jr., they have a massive megaphone. They have such incredible reach. And so, public health folks, I was just in DC last week. American Public Health Association had their national meeting, and we had a big rally with doctors and with public health practitioners on the mall. We marched over to HHS and demanded RFK Jr. be fired or resign or be impeached. And we had, doctors in white coats standing up, speaking out. So we
That's great.
need more of that. We need more people, the voices just kind of ringing out in all these places, because people will get the information somewhere. And it is our choice whether the zone is flooded with disinformation that stands to profit a few and kill the rest of us, or actual beneficial information that can protect everybody. And hopefully, I guess, to me, if you want to make profits making shoes, making refrigerators, making cars, that's great. If you want to make profits off of people being sick, if you want to make profit off of people's healthcare, I just feel like that's not the place for that. And I think more of us have to speak out in that way, building an actual system that doesn't extract every ounce of profit out of people and leave them sick and dying.
Amen. Rob, can you shamelessly promote yourself?
Yeah, so like you said, so I am the executive director. Anyone out there, but particularly any physicians, healthcare providers want to get involved, committee2protect.org, Committee to Protect Healthcare. And then if you want to come on over to our Substack, Paging America podcast, comes out every week. Myself and my chief of staff my co-host Miles Baker, who comes from the political side. We examine the power and profit and politics of healthcare and how we can help build a better system, a more just system for patient-oriented care.
It's fantastic, and I'm gonna have this up on our Substack, and you're probably gonna have it up on our Substack later today. And we're gonna
Yeah.
link to the fantastic resources, and specifically the link to Community to Protect Healthcare. But folks, we don't have to live this way. That's what I want people to just. We don't have to live this way. There is a better way forward, and we have the numbers. And I feel like for the first time in a long time, Rob, people are fed up and people
Yeah.
have a righteous rage. And people are like, I don't have to live or die like this. And why the hell do other countries have paid parental leave? How come I don't have paid parental leave? And free buses. That sounds like a good idea. And why do billionaires get to build rockets and imagine going into friggin' Mars and space? And I can't imagine affordable healthcare.
Yeah.
I think that sometimes that righteous rage and also some horrific mistakes that could have been avoided, but alas, we're human beings, self-destructive species. Sometimes it wakes people up to a better future. And so I do think that the more and more people are informed and the more and more people can dream of what could be, I do think it can be achieved. Because I'm old enough to remember, Rob, 10 years ago, affordable healthcare was seen as a pipe dream.
Yeah.
And living wages was seen as a pipe dream, and all these things were, taxing billionaires was seen as a pipe dream. Marriage equality was seen as a pipe dream. Desegregation was seen as a pipe dream. So I think we need to really be aggressive, especially when it comes to healthcare, and especially as we're going to witness. I hope I'm wrong, but we're going to witness the resurrection of measles and polio and new forms of COVID, and we're going to see brain drain and women die and children die. I hope I'm wrong, folks, but the writing's also on the wall. This is what's going to happen, and we still haven't even gone to the phase where Medicaid is about to be sledgehammered to
Mm.
pay for permanent tax cuts for the rich. That's happening, folks. And you said it. You said something that Dr. Kavitha, who was on, said it also. This is generational damage. Generational damage. So it's a long walk. It's a long walk, folks, but you got two choices. You do nothing or you do the work. And so I appreciate Dr. Rob doing the work. Thank you all for watching. There's almost 1,500 people watching. We're going to have this conversation up in an hour and then come back at my 3 p.m. because I'm going to have Eric Blank of Jacobin with a fantastic Jacobin. I don't know how to pronounce it, but someone will tell me. He's done some 3 pieces about the way forward after the Democrats caved and how to harness the energy of the No Kings rally. So he has these 3 really good articles. I want to talk to him about it, how we can marshal the majority and the righteous rage forward, despite the caving and the weakness of so many Democrats who seem to have thrown us under the bus, Rob, and
Yeah.
not gotten permanent extensions on this Obamacare subsidies. It's going to get rough, folks. It's going to get rough, but we have to get through it together. Everyone be kind, be informed. And if you can, please subscribe. I'm a terrible capitalist. Everything is free on the left hook. If you could be a paid subscriber, great. If not, spread the good word. I'll be back at 3, and this will be up later today. Thanks so much, Rob. Come back anytime.
Pleasure. See you soon.